Hi everybody, welcome to Look, Live, and Be Better on Facebook Live. I'm Dr. Anthony Yoon, America's holistic plastic surgeon, and today we have got a very interesting topic. This is a very controversial topic in plastic surgery, and really it's the fastest growing segment of cosmetic medicine today. The numbers really are staggering how quickly this field of cosmetic medicine is rapidly increasing in numbers of people who are having these procedures done. Now, I have never actually talked about these procedures in public before because they are controversial, and as a male plastic surgeon, I think it's somewhat difficult to actually discuss these and not come across maybe the wrong way. Now, there are doctors who talk about these procedures, and I really think that they have to be handled with a lot of tact in order to really, I think, do them justice. So we're going to talk today on this Facebook Live about plastic surgery of the private parts. Now, if you've been listening or watching my podcast, Look, Live, and Be Better, this past week, the podcast for this past week is the same name, Plastic Surgery of the Private Parts, and I interviewed a very popular plastic surgeon, Dr. Heather Furness, about it, and she does a lot of these procedures. So if you're interested in it, I definitely encourage you check that out and take a listen, and then once again, see if this is something that you might be interested in. But we'll go over it right now. And what I'd like to do is go over some of these procedures that I talked about on the podcast with Dr. Furness, but also talk about a few others that you may find interesting. So here we go. So the first one we're going to talk about is labiaplasty. Now, labiaplasty, of all of these plastic surgeries of the private parts, is probably the one that is the most well documented. There are a lot of articles written about it in our scientific journals. A lot of plastic surgeons do this procedure, and what this basically is it's a surgical procedure to remove excess labia. Now, females have two labia, the labia majora and the labia minora. And the labia majora are the two kind of mounds outside the vagina, and the labia minora is basically the skin, the lips of the vulva. And this procedure is basically a surgical procedure to remove or to literally excise or cut out excess labia minora. Now, you may think about, why would somebody do that? I mean, it does sound like it's kind of an extreme procedure. Well, technically, there are a lot of women who have issues with it. And the issues typically are that when having intimate relations, or even sometimes when exercising and doing things like riding a bike, excess labia can get pinched and it can actually cause pain. So there is that group of women who have this done really for a functional reason. But there is also the cosmetic aspects of it too, and that's where it gets into a little bit more of murky waters. There are a lot of women who are having this procedure done, this surgery done, as a way to basically, in their opinion, look better down there. And that's where, like I said, it can get a bit controversial. In the podcast, I do discuss with Dr. Furness what are some of the reasons why people have this surgery done, and it is surgery. And there are some articles also written about how this surgery may be affected by the massive preponderance of internet pornography that is out there, and is that actually influencing it? So there's a lot of kind of aspects into this procedure that can be very controversial. There's many reasons why people do it. Suffice it to say, I think that there are definitely valid medical reasons to have it done, and maybe cosmetic as well. But once again, I think every situation is really individual to the patient. Now, this surgery itself is a surgery. Some people have it done under a general anesthetic in an operating room, but there are actually doctors, believe it or not, who are doing this under a local anesthetic in the office setting. And I know doctors who do that. Dr. Furness, who I interviewed for the show, she does that as well. To me, it seems like it would be quite uncomfortable, but the doctors and the patients tell me that it actually isn't. So that's labiaplasty. And that, of all the procedures, is probably the most written about, the most discussed. And it is getting much more popular. Every year, the number of women who are having it done is definitely increasing. And the great thing now is that the doctors who are talking about it, a lot of them are female plastic surgeons, who I think have a much better understanding of how it feels like to have this be an issue for you. So I think that's actually a good thing in our specialty. So that's labiaplasty. Well, the next one we're going to talk about is ThermiVa. And ThermiVa is a very interesting, fairly new treatment in the field of cosmetic medicine. And this is a radiofrequency device, a radiofrequency treatment that has been gaining popularity really over the last year or so. And what this radiofrequency treatment does, basically, it's non-invasive. It's basically a radiofrequency probe that is applied to the external labia as well as internally into the vagina. It emits radiofrequency energy, or basically heat, to heat up those surfaces. And by heating up those surfaces, it can actually create new collagen formation, and it can increase circulation to those areas. So what does that do? Okay, well, it heats the areas up. How can that actually help somebody? Well, believe it or not, there are a lot of things that ThermiVa apparently really helps people with. Now, the interesting thing is, if you, probably the most popular plastic surgery website is called realself.com. And according to RealSelf, ThermiVa has a 96% approval rating. People, basically 96% of people, gave this treatment a thumbs up. And that is a huge deal, because that many people who are having it done are satisfied. So what does ThermiVa do? Well, by heating up the external vulva, it can actually cause the external vulva to kind of shrink in size a little bit. But probably more important is, by heating up the internal vaginal walls, it can cause, even immediately after one treatment, the internal vagina to be tighter. Okay, and that can obviously affect the the experience of intercourse. But the other thing that it does, by increasing circulation, is it can also increase the moisturization to the area. It increases lubrication by increasing the blood flow. And a lot of women who can get maybe thinning of the vaginal walls as they get older, and especially after menopause, can find that those vaginal walls are actually thicker afterwards, and that can help their experience. Now, one of the things I mentioned in the podcast was, I had a patient of mine, an older patient, real sweet woman, who said, "Look, Dr. Yoon, I haven't had sexual relations with my husband in decades, literally decades, because she had so much discomfort when she had intercourse." Well, she had the ThermiVa treatment, and I'm not sure how many treatments she had. She didn't tell me that. But after doing those treatments, she said she could actually have intercourse again. It was actually pleasurable for her. So that's a huge deal, and that's something that can really impact a person's quality of life. And the great thing about ThermiVa is it doesn't hurt. There's no invasiveness to it. It is a radiofrequency probe that creates kind of a warm sensation to the area. It is typically, each treatment's about a half hour to 40 minutes. They do recommend, most doctors recommend 3 treatments spaced once every month for 3 treatments. And then typically it's 1 treatment every year as kind of a maintenance. So really not a bad thing. Now, the cost, according to realself.com, is about $2,650. So it's not cheap, because you are paying for that technology. But for those people, if you are watching this today and you have, let's say you're past menopause, or even if you're not, and you have difficulty with intercourse, you've got, let's say, dryness, or you've got soreness, or you're looking to kind of tighten it if you've had children, then it could be a treatment that could potentially benefit you. So ThermiVa, definitely getting that thumbs up from the vast majority of patients. Well, what about the O-shot? You may have heard of this. This is a newer treatment as well. The O-shot is basically injections of platelet-rich plasma into certain areas around the vagina and even in and around the clitoris. Now, this is a procedure that was trademarked and patented by a doctor, and so I can't speak a whole lot about it. But this is basically injecting growth factors, which you basically draw blood from your arm. The doctor spins that blood down, removes the platelets, which are rich in growth factors, and then injects that into the vagina, into certain areas of the vagina and around the clitoris. And the idea behind those injections is kind of similar to what you get with ThermiVa. The idea is that it can improve the experience of intercourse, but it can also supposedly help thicken some of the vaginal walls, maybe create some rejuvenation in that area, maybe increase lubrication, that type of thing. So on realself.com, the O-shot does have an 83% worth it rating, so it's not as high as the 96% with ThermiVa, but still a high worth it rating. And the cost, according to realself.com, on average is about $1,175. So an interesting treatment, the O-shot. Well, what about the G-shot? Now, the G-shot's been around quite a bit longer, and I have commented on this procedure for news before. But the G-shot is an interesting treatment that I don't think is done quite as commonly as it used to. But it was devised by a gynecologist in Beverly Hills, where you actually take a hyaluronic acid like Juvederm or Restylane, and you inject it into the famed G-spot. So yes, the G-spot does exist, but you inject it into the G-spot, and the idea is that by injecting a filler into the G-spot, it can actually increase the size of the G-spot and cause the experience of sexual intercourse to be enhanced. So the question is does it work? Well, Real Self does not have a worth it rating on it. Unfortunately, there haven't been enough reviews to give it a worth it rating. There aren't any big studies or anything like that that has proven its effects, but it is an interesting idea. So it's not something that I would encourage you to go rush out and have done, but an interesting idea, and it's not a procedure that I've done, so I can't comment from personal knowledge, but that's the G-shot. So when you're kind of putting it all together, if I had to look at all four of these procedures, or all three of these procedures, the O-shot, the G-shot, and ThermiVa, if you're going to try something, if you're trying to enhance kind of the experience, then ThermiVa is what I would start with, because it's completely non-invasive, so you're not taking needles down there. And the studies, the anecdotal reports from doctors that I've heard, the studies, as well as Real Self, which really I think is fairly accurate, does portray a really good picture of that procedure. So now we've been talking all about women so far, and 90% of plastic surgery patients are women, but what about men? What about the men? Well, there aren't nearly as many cosmetic procedures for male private parts as there are for females. And why that is, I can't say. But there are a few that are out there. And this is the first one. Don't laugh. Scrotox. Yes, Scrotox is a real word, and it is a real procedure. So, what is Scrotox? Well, Scrotox is injecting Botox into the scrotum. Now, why the heck would somebody want to do that? Well, initially the idea is, honestly, my thought is, I have no idea. It doesn't make a lot of sense to me. But when you think about it, this is the idea. If you inject Botox, now Botox is botulinum toxin. Now this is an off-label use, okay, and most of these, the O-shot and the G-shot, you're looking at off-label uses potentially of some of these products, but this is a definite off-label use, so not approved by the FDA for this. But the idea is that if you inject Botox into the scrotum and the muscles around the scrotum, basically the smooth muscles that cause the scrotum to tighten up and to elevate and stuff like that, then you can cause those muscles to relax. And by getting it to relax, the scrotum will actually look less wrinkled, which I don't know why that would be important to somebody, but I suppose it can be. But it causes scrotum to be less wrinkled, and it causes the scrotum not to lift up, and so it kind of sags a little bit more. It drops a little bit more. And I guess the idea is that it makes the scrotum look bigger as well. Once again, why anybody would care, it's beyond me. But so this is a real thing. There are doctors injecting Botox into the scrotum called Scrotox to cause basically the scrotum to look smoother and to be more settled. Once again, I don't do this. I have no plans to have anybody do this to me, but it is a real thing. So what's the next one? Well, the next one is Juvederm injections into the penis. Yes, that too is a real thing. There are doctors who are advertising that they will inject Juvederm into the penis as a way to make it look wider. Now, you don't want to inject it into the glands of the penis to try to make the penis look longer. That's not going to work, and that could be very dangerous. But these doctors are injecting it into the shaft of the penis as a way to make it look wider, to increase basically the girth. Does size really matter that much? I mean, to take a needle and inject it into your penis that way to try to make it wider for 6 to 12 months, I've never seen this done. I can't imagine why this would really be something somebody would do, but people do. There are risks with it. Once again, this is an off-label use of these fillers, and if you accidentally inject it into a blood vessel, oh, God help you. Not something that would be very pretty. So if you're thinking about having this done, be very careful. Really do your research. Talk to the doctor. And and make sure it's done as safely as possible. But that's the Juvederm into the penis. Now, if you're interested in these types of procedures, I really dive deep into it with Dr. Heather Furness. She's a very popular plastic surgeon. She's in California, Santa Rosa, California, where we discuss all of these things. All these things, the first ones, we discuss Labiaplasty, ThermiVa, the O-shot, and the G-shot. If you take a look at my the iTunes, it's dryoon.com/iTunes. Check it out. And if you're interested to learn more about these female plastic surgery, the private parts, encourage you to do that. Now, last week I did mention that we are going to give away an iPad mini to somebody who shared and I'm sorry, not who shared, but who subscribed to the podcast. And the winner of the iPad mini is Catherine L. Catherine L. For your privacy, I'm not going to give the last name. Catherine L. We are going to email you. Once we get your email address and your information, we're going to email you. We'll contact you, and we will send you your free iPad mini for subscribing to Look, Live, and Be Better. Now, what we posted it today. If you're interested, I'd like to have you watch this quick preview of my next podcast.
Body lotions and oh my gosh, so you name it. There's just like fragrance in just about everything that we use on our body. But unfortunately, fragrance, when manufacturers put fragrance on the label, it's an opportunity to hide a lot of ingredients that don't have to be put on the label. And for example, one of those ingredients is diethyl phthalate, and there actually may be other phthalates. And phthalates are plasticizing agents. They're known hormone disrupting chemicals. And they do show up in human samples and urine. And so we know that our bodies were getting absorbed by in our personal care products, and that they do have these hormone disrupting effects.
So just a quick preview. So the podcast this week is called 2 Weeks to basically clean and beautiful skin. It's with Dr. Trevor Cates. She's known as the Spa Doctor. She's a naturopathic physician, and she is a skincare specialist. She recently wrote a book called Clean Skin from Within. And if you take a listen to the podcast, great thing. This is a very interesting book, a book all about holistic skincare. So if you're interested in looking younger without putting harmful chemicals on your skin, if you're interested in what the gut the communication between the gut microbiome and, believe it, your microbiome on in your skin. If you're interested in things that you can do to look younger, she's got this plan. Literally, give her 2 weeks, and she can get you clean, beautiful, younger skin in literally 2 weeks. I've read the book. I think the book is great. There's tons of recipes there. It really is a holistic guide to looking younger and taking care of your skin. And the great thing is, if you listen to the podcast, we do give you a website where you can go and actually get her book for free. All you do is pay shipping and handling, and you get this book. It's a hardcover. I think it's hardcover. It may be softcover. But it's a book you can get for free just by logging on there. Now, if you like this video, if you comment on, let me know if you like it by commenting, and you can win over $250 value of ZO Skin products. And this includes a full-size cleanser, a Brighten X, and a C Bright Vitamin C Serum. And like, comment, and win. This isn't for sharing. Unfortunately, Facebook frowns on giving stuff away for sharing, but you can like, comment, and let me know that you liked it by commenting, and we will choose somebody and announce it next week for the winner. Now, next Wednesday, we are going to kind of finish up. If you can get a chance, check out the podcast this week, because it'll kind of get you started. And next week, we're going to talk about dangerous ingredients in your skincare products. So, we've all got bathrooms half filled with lotions and potions, and there are things that you do need to watch out for, things you watch out for your own skin and for your children as well. Now, I do touch on it in the podcast with Dr. Cates, but there's also more that we'll talk about next week here on Facebook Live. So if you've got questions on these plastic surgery for the private parts, or if you've got some questions you'd like to ask that I can try to answer next week, I'll be on here answering a few questions here for a little bit. I appreciate you watching today and tonight. This is Look, Live, and Be Better on Facebook Live. I'm Dr. Anthony Yoon, America's holistic plastic surgeon. Thank you for watching.